Thank you, Dr. Mukherjee. Well, you have been getting a macro picture all this time. I am primarily a specialist surgeon, and I just happen to have to run a small setup, a micro setup, on a specific subject. And the issue that we are discussing about, let us enter directly because time is short as we have been discussing. I will keep the pharmaceutical side apart because it is a different ballgame, and I'm going to talk about the rest of it because pharmaceuticals will be covered just after me. As a surgeon, the things that we are bound to will be enough, are some heavy equipments, some investigational support devices, hand instruments, implants that will live inside the patient, and things can go as fine and small as even the stitches. Do we not have manufacturing of all these in India? We do. We actually have all these products made in India as well, but the quality, if you have to compare, because all of us who have been trained in a wide range of areas all over the world and got used to a certain quality to be used in human beings, we cannot use many of the products that are made here because it is actually the second and the third class technology which is being used. India has got much superior technology, but because the 1:1 revenue generation out of the medical products is difficult in certain areas, because really investing on high tech is like investing on the expedition to Mars. One day it can be the most valuable investment that you have done, but today, for a few days that you look at in the near future, you may not see the 1:1 return. That's why the players who are into the field of developing some of the equipments, the things that I have discussed about indigenously, their quality, unfortunately, really you cannot use it in the operating theater. So, we have talked about the problem a little bit. Let us talk about a possibility of a solution. We do have our biotechnology people, and unfortunately, biotechnology, the available seats to create a trained specialist biotechnologist in India, that is quite constricted. The number of biotechnologists that we will produce every year is quite limited. There has to be a focus on that side. There has to be a core group to visit the rest of the developed world and actually hijack back our boys and girls who are out there in the biotechnology section of the biggest players in the world, and let them get conglomerated with the specialists who are actually going to use their products. These are the surgeons and doctors that we are talking about. They should sit together, who have been used to using the best quality products, and these are people who have been used to producing the best quality product in the technology section. And in between comes the logistic issue which has been brought up just now. Who is going to fund all this? Now, this is an area where it is very easy to say that the government is not spending the funds in the right way, but government is not the only player in this. We must understand that. And we have to have government and private players, and there has to be, because it is a social issue, there has to be really policy decisions so that such developments of technology, which is at par with any other part of the globe, that develops here. It is not just somehow make in India, because that is possible and that is going on. There are big companies that produce, even I'm talking about sutures, stitches. They produce stitches. It is almost a small scale, but they are being produced in a huge way as well. But believe you me, when I put the needle through a tissue, I will not use names, but when I put the standard international brand, 10th stitch, 105th stitch doesn't really matter for the tip of that needle. But the Indian brand, by being very patriotic when I tried a few times, well, being miser as well at sometimes, when I tried a few times, after 10th, 11th, 12th stitch, I threw it away and I have never purchased it again. And these, I am not talking about tiny chantry producing stitches. I am talking about real huge companies which are producing these stuff. And another disastrous thing, because big companies are opening their shops here, their technology shops. Remember, a cutting drill, a tiny micro cutting drill that I would have used in England, or when I first came back to India and purchased directly from abroad, that lasted me 10 years. And when I am buying the same product, the same brand, but somehow partly assembled in India, it is not lasting me more than 18 months. It comes with a guarantee of 12 months, and it conks off very soon after the 12 months. And they always say that it is a tight fixed product, and you cannot open it up, so you have to throw the whole system, and you have to buy a new one, and that's how these products are being prepared when we are just following word for word the thing called Make in India. It's not exactly that. Bring the quality up to the level, and then only Make in India makes sense. And it is trying to get the quality rather than just another product being made here. That should have a bigger stress. That was point one. I will very fast finish off point two. The biggest equipment in our the biggest item, instrument in this industry is the specialist, is the person who is actually performing the show. And I believe quite a few postgraduate doctors are here who know very well that just at the end of the postgraduate training, I'm talking surgery because that's what I understand a little bit, it is very little that the person has completely trained into. So the post-graduation actual hands-on training area has not been addressed properly. Many of the associations, fortunately, I'm presently chairing the Indian board in my subject, and we are working very hard to develop fellowship programs at different centers. We are getting centers together, and the funding for the maintenance of these boys is coming out of our pocket like chanda. That's how things are going on, and I don't think that is the best way for a huge country like India. This can develop. So there has to be a big stress on manpower, medical, as well as paramedical in the real specialty training to develop the best equipment here in India, because worldwide, because here, our big focus is the balance sheet. Here, I think there is a big idea on the economic side of things, and as I think today only we had something in the newspaper which clearly stated it, what is the huge degree of influx of international patients from the developed countries to here, just from the cost point of view. And they also know that these are people who are equally trained and equally skilled, and there are infrastructures in certain pockets. So patients are flowing in, and that can be made really many fold, and that can logistically justify many of our efforts. But the first point has to be medics as well as paramedics being created in a fantastic work culture in a way which can only be developed by stars from the peer group who should be got together, because they are all scattered. Some of them are in the private sector, and when they're in the private sector, they're in one group and they are not friends with the other group. When they're in the government sector, they are sometimes very unhappy that for the same degree of work, they are earning less. These kind of human petty problems are there. Healthcare is an area where these problems cannot be given a priority. So a joint, as Dr. Bodua mentioned in the first lecture, in the lecture before this, the group discussion, was that the old-time trust hospitals and such stuff, there are certain interesting areas to be picked up from that. It has to be the similar mentality, but controlled in a very professional, modern-day, economically viable way. And that is possible by getting such individuals, such trained specialists together. So one is equipment, standard, quality, has to be given equal stress, if not more, than just to have an office to get things screwed together somewhere in India. That's point one. And point two, making the human resource the biggest instrument, the biggest equipment for healthcare in the right way, to the right precision and perfection. Because they are of that standard, they have proven everywhere in the world. And they do that here as well, but they are kind of like, these are just individuals. These are not groups and generations of people. Some of us are trying to train a few, but but those are just absolutely inadequate for the problem that we are facing. So there has to be, like even Ms. Devgupta is here, and there are other big corporate hospital setups. They can all have a bank somewhere to produce better specialists. There has to be a basic level of incentive to survive and to feel happy. And this new generation of super skilled machines, finished products that we are going to get out of it, is actually what Make in India is going to help us, and that will also logistically solve a lot of problems. Thank you, Ed.